5th of May is the World Asthma Day. This year's theme is uncovering of the misconceptions of asthma. The reason why it's important is because we find that there are many patients who are not diagnosed, or they do not get the right treatment or adequate medication that is readily available because of these myths and misconceptions. So resulting in limitation in their activities of daily living and can even result in death. So it's important for us to discuss these myths and misconceptions so that our asthma patients get the adequate care that they require. So we go straight into the myths and misconceptions. Some of the common myths and misconceptions are, one, that asthma is an infectious disease. You heard me say that patients with asthma will cough, wheeze, recurrently or regularly. However, it is not an infectious disease. This is actually an inflammatory condition in one's airway that leads them to have this. They cannot spread it from one person to another. So we cannot call asthma an infectious disease. Number 2 is that asthma can be cured. Well, asthma, if well controlled, the symptoms can resolve, and this person will not even have some of these symptoms, or they can have them very minimally. However, it cannot be cured, meaning there are patients who may require this medication all their life. There are patients who, after a while, they are well controlled, and with advice from the doctor, they are told now to wean off the medication, and they stop the medication with regular follow-up. So it's different for different patients, but it is not a curable disease. But if well controlled, a patient can live a quality life. Another misconception that is out there is that asthma is mainly a childhood disease. Well, asthma, yes, you'll find majority of patients who will have asthma symptoms will be children. However, there are those patients who even continue with their asthma symptoms onto adulthood, depending on how their control is. So there are those patients who, yes, as children they have the symptoms, after a while the symptoms go away and they don't even require the controller medications, and the doctor stops them from the medication. However, there are those who the symptoms continue even into adulthood and they require. So it may not be the same case for different patients. So advice from the doctor is very important. Another misconception is that a patient who's asthmatic should not engage in sports or physical activities. That is not true also. A patient who's asthmatic and is well controlled on their medication can engage in any form of physical activity and exercises. We have sports people who are maybe swimmers and even athletes and are asthmatic and use their medication well, and they're able to engage in this. We also have those who require a bit of reliever medication before engaging in the sport, and they are able to continue with the activities that they require. Another misconception is that asthma is psychological, meaning that a patient in certain situations they get the asthmatic symptoms, so the wheezing, the coughing, the chest tightness. Yes, there are patients who you'll find when they are very excited and laughing loudly, they can go into an asthmatic attack. Some when they are anxious or fearful, they can also go into an asthmatic attack. However, it does not mean that this is a psychological condition. It just means that these patients, when they are well controlled, when they go through these emotions, they will not have this particular asthmatic attacks. So it's just about control of the treatment. Another thing, especially here in Kenya, is that asthma is mainly common in cold areas. So you find a family says they need to move from the cold areas to move to a drier area, and so that the symptoms of asthma will be resolved. Again, this might happen, yes, when they move, but once the patient is exposed to other triggers or other allergens within the area they've moved to, even if it's dry, then the symptoms can still recur. So it does not differ based on whether one is in a cold area or a warm area. Another misconception that is there is that when one uses this medication for a long period of time, is that their body will stop responding to the medication. Again, that is not true. One uses the medication as prescribed by the doctor, and the doctor will be able to regularly assess as they go for their treatment and know when to stop wean them off the medication or whether to continue with the medication. And even as they do this, it does not mean that now their bodies are going to stop working or responding to this medication. Another misconception that is there is that because they use steroids, the inhaled corticosteroids, it might affect or stunt the growth. Normally for asthma, they use a very low dose of inhaled corticosteroids that may not lead to this, or that may not lead to stunted growth because the dose is at a lower level. So again, this should not worry a patient that for a child, if they use the inhalers, their growth is going to be stunted. A while back, there was a myth that whenever one used asthma medication, it would weaken their heart. Again, that is not true. However, with some reliever medication, if used excessively, a patient would perceive as though their heart is beating very fast, or they have a bit of tremors in their hand. But if a patient sees that they're using the medication regularly, it means that they are not well controlled. So they need to go back to their doctor and they are re-evaluated, and their medication is prescribed according to their level of control, so they don't have to use the reliever medication regularly. And finally, folk medication or some of our traditional medication can actually result in relieve these symptoms. Well, studies have been done and more are continuing. We've not found scientific evidence to show that asthma can be relieved or treated with folk medication or traditional medication. So I'd advise our patients to continue using the medication as prescribed by their doctor, and in case they have come across any folk medication, to communicate with their doctor so they're advised on whether they should use the medication or not. But that is not, we do not stop using the regular medication or prescribed by the doctor because we're using folk medication, or it's not an alternative to our medication or hospital prescribed medication. We continue using that as prescribed to relieve the symptoms. Asthma and COVID may have some similarities, meaning both of these patients will have symptoms of cough or difficulty in breathing. Some may have chest tightness or chest pain. But remember, COVID is an infectious disease, while asthma is not an infectious disease. And because of that, we cannot call them the same. Another thing is that asthma is relieved by the reliever and controller medications, while COVID is not controlled by any of these. So that is one of the differences of which one can tell. Another thing, a patient with asthma, there'll be a pattern and a history from how the doctor is going to get the patient history and able to tell whether this is COVID or asthma. One, if there's a family history of allergies, so you find that a mother had the same symptoms, a sibling has the same symptoms, or when they're exposed to certain things like dust or certain plants, that's when they have those symptoms. Or these symptoms are more at night or early in the morning, and during the day the patient is fine. Yet for COVID, you'll find that this patient, the cough, the difficulty in breathing is continuous, and also may be associated with other symptoms like fever or other symptoms like headache, joint pains, of which an asthmatic may not have. So for an asthmatic in this era of COVID-19, studies have been shown that COVID-19 does not necessarily increase the symptoms of asthma. However, because we know that the viral infections in certain patients will exacerbate the symptoms of asthma, a patient with asthma should still maintain the preventive mechanisms. When you're outside, one should wear their mask, ensure that they wash their hands, and if they have the opportunity to get the vaccine, to ensure that they also get the vaccine.